When you come upon a trauma scenario, figuring out what to do first can be challenging. Many trauma scenes can be chaotic. If there's an active threat or an unsafe environment due to a shooting, explosions, fire, smoke, or other hazards, you must first make sure that you and the casualty are not in harm's way, or that the scene is safe to enter before attempting to provide medical assistance. You may need to engage enemy troops or suppress flames to get to the casualty. If the casualty is able to move and perform basic self-care, such as putting on a tourniquet, they may not require your immediate help, and you can focus on your safety and other potential casualties. You need to make decisions quickly, as injuries can become life-threatening in just a matter of minutes. You may even need to move the casualty before you can begin an assessment of their injuries. There are specific types of drags and carries you can use to do this quickly and safely, either by yourself or with a buddy. You'll learn about them during another part of your training. As soon as possible, maybe even before you have moved the casualty to a safe area, check for responsiveness by communicating with the casualty to determine if they are awake, and if so, if they are confused or disoriented. Hey buddy, you okay? In a combat situation where your casualty is armed, you should take all weapons and radios from anyone who is not alert and fully oriented. A confused or disoriented casualty may resist being disarmed, so say something like, "Hey buddy, let me take your weapon while I check you out." During the entire process, you need to talk to the casualty if they are awake and keep them calm. Provide reassurance and let them know that you are there to help. Once you take the proper safety precautions, there are steps that you must follow in a particular order to both assess and treat the casualty. In the military, there are many acronyms to help remember proper assessment and treatment sequence. But here we will follow the MARCH algorithm as our assessment and treatment protocol. MARCH stands for massive bleeding, airway, respirations or breathing, circulation, and hypothermia. In this segment of casualty assessment for all service members, we will cover the basic procedures of an assessment. I want to emphasize that in a real event, as you do your assessment, you will want to stop and perform treatment if you find something wrong. The first step is the assessment of massive bleeding, or M, in MARCH. Sometimes severe bleeding is obvious because there's blood-soaked clothing, or large pool of blood, or because you see blood freely flowing from a wound. But sometimes you need to perform what is called a blood sweep. You may be asking if you could do this with their clothes on, and the answer is yes. We don't necessarily want the clothes to be removed, but they can be opened, cut, or ripped. Remember, clothes can help prevent hypothermia unless wet or blood-soaked. Next will be the assessment of the airway, or A in MARCH. You need to make sure the casualty's airway is open. If they are awake and talking to you, this means that their airway is open, but they still could be having trouble breathing. If they are unconscious, you must perform an airway maneuver to make sure the airway is open. You will learn these maneuvers later on in the course. To assess for respiration, or breathing, or the R in MARCH, you first need to expose the chest and check for adequate breathing or chest injuries. Look for the chest to rise when the casualty breathes in, and inspect for any penetrating wounds on the front or back of the chest. Respiratory distress is when the casualty is having difficulty breathing. In other words, they struggle to get air in or out, or their breathing is too weak to be effective. Check the casualty's respiratory effort and ability to breathe. Now it's time to assess for circulation, or the C in MARCH. When you lose too much blood, you can develop a condition called shock. Shock causes the body to shut down due to large amounts of blood loss. Shock can be caused by gunshot wounds, amputations, or other severe injuries. To check for shock caused by bleeding, look for a weak or absent radial pulse, which you can feel for on the outside of the casualty's wrist, about an inch below the thumb pad. Other things that might indicate shock are dizziness, confusion, or pale, cool skin with sweating. Finally, in those casualties with severe injuries, they could develop hypothermia, or the H in MARCH. Hypothermia can lead to an increased bleeding. Look around to see if their clothes are wet and what type of surface they're laying on, and take steps to minimize heat loss. After you assess for the most immediately life-threatening injuries, you need to go back and check for additional injuries, such as head injury, eye trauma, burns, or fractures, depending on the scenario. Also, continue to monitor the scene to ensure safety for you and the casualty. Remember, throughout the entire assessment process, communicate with the casualty by reassuring them and telling them about what you are doing. Also, communicate with other first responders, medical personnel, and relay your casualty's injuries and status to your command. Finally, you should write down what you observed, and ultimately any treatment that you provide, so the next person to take care of the casualty has that information. You should always fill out a medical card, DD Form 1380 if one is available. This should be in most military first aid kits. I'm going to briefly show you the card and types of data that can be filled out on the card. When rendering care, include as much information as you can on the card. To recap, first communicate with the casualty and disarm them if necessary. Then assess for massive bleeding by performing a blood sweep. Next, ensure the airway is open and evaluate the breathing. After that, assess for shock and hypothermia. Then look for other injuries such as head injury, eye trauma, burns, or fractures. Remember, communicate with the casualty at all steps, and finally document all care on a DD Form 1380 field medical card if one's available.